Thank you for having me here today. I'm speaking to you today as a harmed patient, someone who unfortunately will lose her life to serious medical error. And it didn't happen to me once, it happened to me twice. So I have to speak about that. That's what I'd like to speak to you about, and about my hopes for improving post-harm policy, practice and policy for people harmed by medical error and adverse events. So here I am. This is me in 2014. But my story actually begins in 2008. And at that time, I went with my sisters and my mother on a trip to Scotland. We were celebrating my mother, who had had colorectal cancer, her 10-year cancer anniversary. Here we are at Loch Ness. On that trip is when I first started to experience the daily rectal bleeding, which was the hallmark of my cancerous condition. So as soon as I got back from this trip, I immediately started a search for a correct diagnosis, which unfortunately went seriously awry. At the time, I was 46 years old, and I had a son only 13. So 46 is not far from 50, but at 46, I was deemed too young for colorectal cancer by 4 doctors in a row, 3 family physicians, and a general surgeon. And that was despite the fact that I had active symptoms, bleeding, as you see here, from the tumor, which this is an image of my colorectal tumor when it was finally discovered. I had a 2-year wait for any kind of endoscopy because those 4 doctors believed that people under the age of 50 could not get colorectal cancer. I also had a positive cancer screening test, and that also was ignored by the doctors in question. So afterwards, I made a complaint to the College of Physicians of Nova Scotia, and the 4 doctors were disciplined for egregious cancer negligence. So I was successful. It was a long process, a daunting process, but that I did do that. Also, I might tell you that I successfully sued all 4 doctors in a medical malpractice action. In 7 years of litigation, the defense for the doctors, the CMPA, acknowledged that they could not find one expert anywhere in the world able to defend the standard of care I received, because that's how bad it was. So what did that mean for me? It meant, 5 chemotherapies now, a picture of me at the beginning of one, and another picture at the end. You can see for yourself how ravaging the effects of those treatments can be. And then that was 5 rounds of different kinds of chemotherapy, ultimately 6 surgeries. In fact, I only just got out of hospital 2 weeks ago. That was really harsh. There was radiation in there too. So I've gone the gamut of really harsh treatments for colorectal cancer, which sadly turned out to be a stage 4 disease because it was diagnosed too late. So once I went into remission for about 7 years, and during that period, I really tried to earn that remission by becoming very, very much an advocate for people in the cancer space. So I was active on social media and other forums of trying to get the word out about colorectal cancer. And I served on a provincial working group along with various experts to develop standards of cancer care. Particularly, my particular interest, of course, was diagnostic care. Could we standardize diagnosis so those kinds of grotesque errors would not happen to anyone else? Unfortunately, these reports were shelved by the government when we had a change in government. I wrote a book about my experiences, about the medical wrongdoing, my struggle to survive, and also the fact that unfortunately my province of Nova Scotia was the only place in the Western world that did not have the best practice chemotherapy for my kind of cancer. So my community and I lobbied the provincial government to extend the formulary to, which happened, but unfortunately too late for me to receive it. So there's a bunch of awards that the book got. It's a cracking good read, if I do say so myself, but it does document these first struggles around and my first taste of advocacy. For that advocacy, I was given this medal by the Medal of Courage by the Canadian Cancer Society for that work in trying to bring about standards of care for all cancers, but colorectal in particular. And then as another aspect of that work, I was decorated by the Governor General of Canada, as you see here. That was in 2016 for the work in fundraising, advocacy, and improving our provincial formulary so that 1,000 Nova Scotians have had access to the best chance at cure since the days of our advocacy. But unfortunately, I have to say that lightning can strike twice, and it did happen to me again, another really serious medical error. So you can be a prominent cancer advocate and a prominent patient and still be significantly harmed a second time. And what happened in the second time was my disease recurred after about 7 years, but it was missed on radiology by a distracted radiologist, a 2-centimeter tumor. He missed it and wrote a report saying I was fine. It took me 6 months of incredible lobbying to say, I need a new image, which of course revealed a malignancy, but was no longer 2 centimeters, it was 10 centimeters. And it was now involved throughout all the organs in my pelvis. When I had the surgery for it, the surgeon came in, took my hand like this, and he said, if I'd had it at 2 centimeters, I could have saved your life. It was too late. It's too late. It has moved to an inoperable location. Recurrence and death are a matter of time. So that's where I stand today. I sought, because I'd done the college complaint and the medical malpractice lawsuit, this time I tried to approach the radiology error through the ordinary hospital complaints process. And it was clear to me right away that the people involved had no training in error and apology. The clinicians involved, the management involved. I actually spoke to the doctor involved who made the error, and he was just, as I see, he was like Mr. Spock. He said, "You're in my margin of error." That was his response. So I'm a member of Patients for Patient Safety Canada. We're a vetted group of harmed patients that work to improve healthcare. And here we are meeting with our Minister of Health here, Randy Delory in Nova Scotia, in order to, as we went across Canada, Patients for Patient Safety, we're really trying to improve post-harm care and practice in every province. So what are my hopes for healthcare? Well, I'd like diagnosis of cancer to be improved generally, but in particular, I'd like to see improved patient-centered post-harm practice. That it would really, really help if we could have a better training for all health professionals and management in how to do that compassionately. Thank you.